Can you tell us why it's important for a mother to choose a hospital that has a neonatal ICU in it when she's choosing a hospital to deliver her baby?
Well, I think it's always important to have a NICU available when you deliver a baby, even if you think there's no way that you would ever need it, because there's always the possibility of a complication, even in after a full-term pregnancy that has had no problems at all. So it's important to have that facility in such close proximity, rather than having to put the baby in an ambulance and transfer the baby to another hospital some miles away where there is an intensive care unit, just in case.
Is there a way for a mother to know whether or not she will need a neonatal ICU for her baby?
Well, yeah, I think most of the time it's very difficult to know that that one is going to need a NICU after delivery, unless for whatever reason a mom knows that she's going to deliver prematurely and that the baby is going to need to stay in the hospital. I think a lot of the complications of pregnancy that may increase the risk of the baby needing a NICU, it's not a for sure thing, so she won't know for sure, even with gestational diabetes or hypertension. Most of the time I think a mom won't necessarily know that her baby is going to need a NICU, and that's why it's kind of important to deliver in a place where there is one, just in case, because you don't know that in advance. So a neonatologist is a type of pediatrician. So we trained to become a pediatrician, and then we did additional training to just specialize and focus on newborn babies. So for the most part, we take care of premature babies in the neonatal intensive care unit, but also we take care of full-term babies who, for whatever reason, need to go to the NICU. And sometimes we take care of babies who are maybe a few days old or a week old that have gone home and need to come back to the NICU to be treated, usually for jaundice. So for the most part, though, we focus on newborn babies, whether they're preterm or full-term, and then maybe those who are less than a month old.
If a mother is anxious and worried about her baby going to the neonatal ICU, is there something you can tell us to reassure her that it'll be okay, and about the team of specialists that will be caring for her baby?
Well, I think first of all, it's usually very overwhelming and scary for any mom or dad or family members when a baby needs to go to the NICU. And it's going to kind of depend a lot on the reasons that the baby is there. But it's very overwhelming and scary because the baby's being taken away from the mom's room, and it can be a very hectic place, and sometimes it's a very loud place with lots of alarms and there's lots of people. The team that takes care of each baby is huge. It's not only just there's a doctor and a nurse and sometimes a respiratory therapist. We have social workers that come around and talk to all the moms. We have dietary and nutrition support. And we have therapists that work with the babies. So sometimes there's a lot of information thrown at a new mom all at once. And I think it takes a lot of time for them to kind of adjust to the environment and to adjust to everything that's going on. But everybody who's involved in the care of the baby, we all are there to help each other. We work as a team, and we all have the baby's best interests in mind, and that's our goal. We do a lot of teaching to the parents as well of everything that's going on with the baby, and usually by the time a baby is discharged from the NICU, the parents have become NICU experts, and they kind of have learned a lot about everything that's going on and everything that we've done with the baby.